So just to have a formal introduction, this is a slide which we have put up. Padma Shri Professor Dr. Shashank Joshi is MD DM in endocrinologist. He's the fellow of American College of Physicians and Royal College of Physicians. He is also a part of the American Association of Clinical Endocrinology. He belongs to the Department of Diabetology and Endocrinology at Lilavati Hospital Research Center, Mumbai. He's the president of two important organizations, the Indian Academy of Diabetes and the Endocrine Society of India. He's the former president of the Association of Physicians of India. He's the RSSDI and the All India Association of Advancing Research in Obesity. He is involved with the activities of ACE. He's serving as chairperson of its India chapter. He's a recipient of International Clinician Award received at 21st American Association of Clinical Endocrinologists. Senior editor of Endocrine Connection, delivered more than 200 oration. He's the receiver of the Padma Shri, and he's been very active in the COVID times. He has been one of the forefronts in Maharashtra COVID task force, and we look upon him as our esteemed mentor and guide. And when we started this MBM group, I remember on Telegram he had a lot of intellectual text which used to be posted, and I have people in the group who have still saved those posts and they have been benefited with his wisdom and wit. So today it is my pleasure to present Dr. Shashank Joshi sir with the prestigious Dr. V.A. Lokhandwala oration. Over to you, sir. So I think sir is live, if he can come up, or we start the presentation which he has recorded.
So, Vaishali, you can start the presentation. I'm grateful to you and the organizers for feeling me worthy enough for this talk. And I'm recorded my talk for 26 minutes, after which we can have a dialogue or a discussion. Thank you so much.
Yeah, thank you, sir. So, Darshan, can you just play sir's recording?
So, at the onset, let me thank the organizers of Mind Body Medicine. And I'm really going to talk on subject of impact of lifestyle, gut microbiome, ancient wisdom and modern medicine. I don't have any conflict of interest for this talk. I anticipate what you listen to me, you will learn, and what you learn, you will adapt. My talk is divided into multiple components, and it is a cross-section of lifestyle medicine. So first thing which we learned, as we have seen in the post-pandemic times, is rebooting life and building resilience. And I'm going to talk a little bit on that. Then I'm going to talk on biological clocks, chronomedicine, sleep and lifestyle. Then I'm going to switch gears into gut microbiome, how gut health is at the center stage back. Maybe a few lifestyle mantras, including Surya Namaskar and Gayatri Mantra, and maybe one or two take-home messages. So that's the overarching theme of my talk. So we all need to reboot our lifestyle. Clearly, refresh by reconnecting, connect with yourself, and we have a lot of reboot priorities, and we really need to reboot and reconnect. We also need to be emotionally agile, because when we reboot, we forget emotions, and we know that life is very fragile, but it's also very beautiful. So remember, beauty and fragility go hand in hand. And it's important to recognize the need for hope, because ultimately we all live on hope. And it's very crucial and critical that we never forget hope in our paradigm, in our prescription, in our mantras. And it's important to recognize that we all live with hope, and hope is the center stage of the universe. But we are always in a storm. And the best example to negotiate a storm I give, whether it is disease, whether it is external storms, whether it's body storms, mind storms, every storm has energies. Now remember how does an eagle, they use the negative energy of a storm to fly even higher. And I think that's a big motivation for all of us. Simultaneously, we are all warriors. We are trying to, the fate will tell you, we always blame it to fate, and we blame it to destiny. And fate whispers to the warrior that you can't withstand this storm. And the warrior says with a whisper that I am the storm. So that's how one needs to really negotiate storms and bravely face them. I'm a hormone specialist, I'm an endocrinologist, and obviously we have endocrinology closely intertwined with our metabolic clocks, hormone clocks in every cell. But in endocrine biology, we clearly recognize the role of circadian rhythm. And we clearly recognize the role of the endocrine system, the peptides and the steroids when we look into our biological clock. And when you look at the human circadian biological clock, we know that our best coordination is 2:30. Fastest reaction time is at around 3:30. 5 o'clock, which is prime time, has the best cardiovascular efficiency and muscle strength. Highest blood pressure is 6:30 in the evening. Highest body temperature is 7 o'clock in the evening. And around 9 o'clock, our melatonin secretions kicks in. And deepest sleep is 2 o'clock. Lowest body temperature is 4:30 in the morning. And then you get that rapid blood pressure surge early morning. And then, of course, melatonin secretion stops by around 7:30. And then, of course, we have the highest testosterone secretion, cortisol secretion at 8 o'clock in the morning when you are alert and fine. So sleep is a crucial component. That if you sleep less, the tissue perfusion by CSF, if you are awake all the time, there is reduced interstitial space. There is restricted CSF flow and the metabolites accumulate all the time. So clearly the sleep is the housekeeper of the brain, and recognizing that you need to sleep adequately is very crucial, because if we restrict and sleep less than 5 hours, our human transcriptome is getting restricted and you will downregulate and cause disease biology. So sleeping too much or sleeping too less is not good for human health and will lead to diseases including cancers. And we have studied this from our ancient wisdom. We have learned that light and life with moonrise to sunset and sunrise to moonset. We clearly recognize it from our ancient wisdom, and our ancient wisdom clearly recognizes that the course of time is understood through the changes brought about, whether they are the rays of the sun or the moonlight. And that's really the chronobiological clock, which is engraved and ingrained in all ancient wisdom and ancient literature. Blood pressure is the most classical example of circadian rhythms. We all know the evening blood pressure rise. We know that when you sleep, there is a nocturnal dip, and then we know that there's a pre-awake surge and there is a morning surge, which is very well recognized. So as I told you, that our circadian rhythm or biological clock is a basic quality of human physiology. And in healthy humans, heart rate, blood pressure are the best examples, which increase during the day and decrease during the night. And the sleep, wake, rest, exercise changes clearly recognize that. So is cardiac output, so is catecholamines, which rise during the day and fall at night. And various organisms, including human beings, need to adapt to the higher activities when they are up. The most classic example was the intra-arterial monitoring by Milliard-Clack, which is a very old experiment which showed the BP is lowest at night, the nocturnal dip, and rises before awakening, the morning surge. And we all know that when there are cardiovascular events which are crucial, there is absence of nocturnal fall of blood pressure, the non-dippers, the early morning blood pressure surge, which is why you get acute cardiovascular events like heart attacks, stroke, sudden cardiac deaths, and ischemic assault early morning, and the blood pressure variability, which is linked to vascular damage, cardiac damage, renal damage, retinal damage, and mortality. This is again very well known. If you look at our ancient wisdom, and that's why I said I'm trying to see how we can marry ancient wisdom to the modern medicine. The pitta, which is red, the kapha, which is blue, and the vata, which is yellow. You can clearly see that the biological clock timings, various early morning events like thrombotic strokes to sudden cardiac deaths, to the blood pressure surges, to the rheumatoid arthritis flare-ups, to the rhinitis and the migraine flare-ups, to the epileptic seizures. And then when we move from that kapha pravrutti to the vata pravrutti, you get asthma, Prince-Bentley's angina, apnea, congestive heart failure going in the course of the day and when you sleep. And then, of course, as you get up again, you have the whole biological clock. So it's all ingrained. And long time back, our ancestors understood the sleep-wake cycle, the sun and the moon cycle, the earth, fire, water, metal, food, and fire cycle. And they were linked to various organs. For example, heart and intestine, small were the fire organs, the water and was the bladder and kidney, the fire was pericardium, and the triple burner was the endocrine metabolic organs, the wood was the liver and the gallbladder, the metal was the large intestine and the lung, the stomach was the spleen and the stomach. And this may all look crazy. In fact, we have genomes, we have microbiomes, which I'm going to talk about, but we also have electromes now, which talk about positive and negative energies. And all these can be measured now. because we can actually measure the sympathetic system activity, which is the red graph here, and we can measure the parasympathetic activity, which is the blue graph here, and we actually can plot chronocardiograms. We can do pulse beat analysis, and we can clearly do the FFTs, which is the beat to beat control, and we can do heart rate variabilities, and we can actually then, using modern gadgets, actually plot the human circadian time structure. So it is plausible, it is feasible to look at the ancient literature and try to put some evidence base to it in a more granular way. We are now chronotypes. When we sleep, we need to recognize that there are dolphins, there are bears, there are lions, and there are wolves. The lions are the ones who wake up early, get tired and in the early evening, and they are most productive in the mornings. The dolphins are the light sleepers. They have trouble staying asleep the whole night. Their peak productive hours are mid-morning. They are the bears which have energy circles which rise and fall with sun, and their peak productive hours is during the daytime. And then we have the wolves which stay up and sleep late and fall asleep, and when the lions are awake. And the world can be mapped in these 4 chronotypes. In fact, there could be 6 of these chronotypes coming up. And the sleep has a lot of phases. It's of course the reticular formation which is responsible for wakefulness. But then you have N1, N2, N3, which are the part of non-REM sleep. And of course, then you have the REM sleep. And clearly, the sleep-wake regulation is hypothalamically controlled from the suprachiasmatic nucleus. And we know that the serotonin makes us feel energized and the melatonin makes us feel sleepy. And it's the balance between serotonin and melatonin, which is what is the light and the dark. And that's how the whole sleep axis works. And we have all these neurotransmitters for sleep, melatonin and serotonin at the pecking order very high. Of course, we have GABA, adenosine, dopamine, orexins, acetylcholine, norepinephrine, and histamine. But it's important to recognize that we can think clearly, be vigilant and alert, and sustain attention. And we need to be wakeful and cognitive. Healthy sleep is very important for mood and mental health, but for cardiovascular, cerebrovascular, and metabolic health. Sleeping less than 6 hours or too much sleep, more than 10 hours, can impact outcomes and mortality. And optimal sleep duration is the key. And we can measure sleep by scales. We can measure sleep by apps. We can measure snoring times. We can look at sleep alarm cycles. And we can also look at melatonin. You know that it's the blue blocker glasses. It's a chemical signal of darkness. There's a whole science of melatonin called functional splanchnology. And there are protocols on in rehab medicine. We all knew that this was a isolate from the Yale University professor Aaron Lerner, who discovered melatonin. And clearly we recognize that the tryptophan, which gets processed to serotonin, which becomes ultimately melatonin, and clearly regulates the entire circadian apparatus. And we have a lot of sources of melatonin naturally. Dark chocolate, cocoa, cherries are a few examples, more than 70%. Simple things like ginger, bananas, wheat, cereal, oats, rice, barley are very good sources of melatonin. Peanut butter, walnuts, almonds, cashews, pistachios, spices, herbs, green teas are all very good sources of the melatonin, which we see every day. But it's very important to give right sleep advice and have a very good sleep hygiene. For example, the light emitted by phone and television screens shuts off the pineal glands, and therefore from making melatonin, and makes us very difficult to fall asleep and you get insomnia. It's very, very important that your bedroom lighting, particularly for insomnia, should be red, because that's having the least impact on the hormone melatonin, and the bedroom light should be always there. We should avoid coffee, tea, colas, because they shut off melatonin, and we should have an early dinner, and that's very important. So as I told you, the do's and don'ts of sleep hygiene are very important. 6 hours at a stretch, maintain a regular sleep and wake time, wear loose clothing. People who find it difficult to fall asleep, take a bath before going to sleep. Take your medications on time. Try to keep in a cool, dark environment. Try to have a pre-sleep routine and listen to some music. Don't push sleep. Don't have alcohol or nicotine. Avoid coffee. Don't have a heavy dinner or a junk food. Avoid electronic mobile phone, laptops, and try to avoid all these red lights from alarm clocks, street lamps, DVD players, which keep you awake. Do some yoga. Yoga is so crucial. Balasana, the Uttanasana, the restorative poses of the chair on the leg, the winding down pose of the rock and roll by rolls, the Ardha Uttanasana, the Supta Baddha Kosasana, the Vipratikarani, the Savasana. All of them are excellent yogas. And then we have so many superfoods for sleep. You know that tryptophan, which is the basic substrate for melatonin and serotonin in the body, both induce sleep. And carbohydrate foods which make tryptophan, for example, in yogurt, we used to have curd rice at night fundamentally to ensure that there is right tryptophan so that you get good quality sleep. And that has been there ancestrally through our generations, which has been passed on, that the good health habits, and even herbal teas like with the valerian extracts, the lavender extracts, simple things like a pinch of nutmeg can give you good quality sleep. And we need to avoid things in sleep like chocolates, fatty foods, spicy foods, alcohol, midnight snacking, coffee, drugs which are containing caffeine, and try to cut our fluids. Listening to good music is equally healthy. And then, of course, we now recognize that sleep has got its place even in the ADHD guidelines. Last year, we had this excellent 5 S's coming out for people living with diabetes, sitting, and sitting is the next smoking, and we need to break up prolonged sitting. Walk every 30 minutes, sweating, stepping, strengthening, and of course, sleeping appropriately. So we need to break your sitting every 30 minutes. Sitting is the next smoking. So you need to keep, breaking your sitting. We need to sweat it out. We need to build muscle. We need to recognize muscle mass loss is the key, and we need to overcome sarcopenia and frailty. Even if you do 500 steps a day, you can drop 2 to 9% of your cardiovascular morbidity and all-cause mortality. And clearly, 5 to 6 minutes of brisk walk per day can add 4 years of greater life expectancy in your life. And if you do resistance exercises, including activities like Surya Namaskar, Tai Chi, yoga, with flexibility and balance, you can make a difference. And don't sleep more than 8 hours. Don't sleep less than 6 hours. It negatively impacts even A1C and life. Try to have a good quality of sleep and try to have a morning phenotype. Like go to bed early, get up early, rather than a late phenotype. And that's so crucial. Switching gears from sleep medicine and sleep hygiene is the gut microbiome. As I said, there is a genome, there is an electrome, and there is a microbiome. And microbia are at the center stage of health as we go in. We know that we are more bacteria than human beings. Human being is a home to microorganisms 10 raised to 14, which means 10 times more cells, more bacteria are inside our body in human cells. And this largest diversity of microbiome is in the gut. And the microbial abundance increases from stomach to colon in the hierarchical order. And there are 4 groups of microbiota: the firmicutes, the bacteriotes, the acinobacteria, and the proteobacteria. And this was a very elegant article from one of our scientists from Chennai, that they said that the health is not directed to how rich financially you are. It is how rich your gut microbiota is. And that there is a lot of claim and lot of truth in this metagenomics, that you have to have rich gut microbiota to live long and live healthy. And this is very true. This statement was made by Bala long time back. It was almost in 2014, almost 9 years back. And clearly we recognize that intestinal hotspot flora are the hotspot, including diseases like diabetes, which are linked to it very closely. And we have harmful bacteria and helpful bacteria. For example, we have the Pseudomonas, the Proteus, the Staph, the Clostridia, the Enterococci, the E. coli, which are harmful to our body, make toxins, pain, diarrhea. And then we have helpful bacteria, like the probiotic bacteria, the lactobacilli, the bifidobacteria, which modulate immunology, modulate gut and digestion, modulate motility, and synthesize vitamins for us. So the gut microbial ecology has pathobionts and symbionts, and the healthy gut microbiota will ensure that the gut permeability is modulated, the endotoxins don't enter our body, the pro-inflammatory cytokines are not produced, the beneficially active modules like short-chain fatty acids, indoles, are improved with insulin sensitivity. So gut is directly proportional to our cardiovascular health, metabolic health, and it's important to recognize that when we have high fat, high sugar, fast food, when we are stressed, when we take antibiotics, we are actually distressing and disturbing and distracting our healthy symbiont gut microbiota, which are anti-inflammatory and generating pathobionts. And therefore, healthy lifestyle and prebiotics, probiotics, and even fecal transplantation now is emerging as a treatment option in life, in medicine, very closely. We clearly recognize that dietary fiber, we are fibropenic individuals. They modulate gut microbiota. They modulate the short-chain fatty acids. these actually upregulate receptors like the GPR43, 42, which modulate GLP-1, peptide YY, which improve satiety, insulin sensitivity in the intestinal tract. They also modulate the adiposity downregulation, insulin secretion, energy expenditure in the sympathetic ganglion, and blood pressure regulation. So clearly, diabetes, the role of, and obesity, the role of microbiota are very, very well established. And all the metagenomics in type 2 diabetes suggest that there is a link between type 2 diabetes is nothing but a state of moderate gut dysbiosis. And there's a decrease in butyrate producing bacteria and increase in various opportunistic pathogens. So clearly we recognize that when we look at diabetes and the gut microbiota dysbiosis, we see that all these bad bacteria are producing butyrate, and their concentrations are lowered, and we are explosively having the wrong expression of microbiota genes and creating oxidative stress and a pro-inflammatory signature. And that's not good for our body, and we're depleting vitamins. So when our gut microbiota are altered, the intestine becomes leaky, and then you get metabolic endotoxemia, and the insulin signaling through the toll-like receptor 2 and 4 is altered, and we are not able to use our insulin efficiently. It's not just important for metabolic health, but the gut microbiota through various host pathways, including the trimethylamine pathway, the TMA, the trimethylamine inoxide pathway, the TMO, the short chain fatty acid pathway, and the bile acid primary and secondary pathways. They are linked to heart and cardiometabolic diseases. We also have seen that when we use blockers, like say alpha glucoside inhibitors like acarbose, they allow more polysaccharide to reach the intestine. I generated this hypothesis in the group of people way back, 8 years back, that they push the polysaccharide to the colon, they increase the colonic bacterial mass, they facilitate production of short chain fatty acids and hydrogen gas by fermentation of polysaccharides, and that improves the healthy tissues and suppresses pro-inflammatory cytokines like IL-1, TNF-alpha, IL-6, and their cardiovascular benefits. And clearly that data has been shown with the drug. It has been shown with lifestyle modification. It has been shown even this hypothesis from Japan that sometimes flatulence may be good because the molecular hydrogen which is generated by the flatulence actually acts as antioxidants and might reduce the cardiovascular events which was seen in the Stop Anhydride trial. And even agents like metformin, we know that metformin increases the abundance of Akkermansia. It's a mucus degrading gram-negative bacteria in the gut, which is associated with the T regulatory cells inside the gut, which reduces the tissue inflammation in the gut as well as adipose tissue in obese animals. So clearly it can combat obesity and diabetes, the gut microbiota. So gut microbiota are important for metabolic diseases. The gut bacteria make polysaccharide substrate, which make short chain fatty acids and hydrogen gas, which can be anti-inflammatory in nature, and they can be very useful. Finally, as we learn, we need to adapt, and we need to also embrace our past. We have seen and we have learned from Maharishi Charak, who is the author of Charak Samhita, that following ancient traditions of travel by sages, because Maharishi Charak traveled extensively and wrote a Charak Samhita, the greatest treatise on medical human body. We need to pick up the right things from that. And one of the right things is that we are having sarcopenia, our muscle mass is less. And we had embraced a form of an exercise as a complete physical exercise, which was then propagated by the King of Ond and, in the 20s by Iyer and Krishnamacharya, which is Surya Namaskar. And this is something which we recognize very well, that Surya Namaskar is a very holistic and complete comprehensive physical body exercise, which will strengthen our muscles. It has a form of resistance exercise and balances. And we have a lot of mantras and postures. For example, we have a prayer pose, a raised arm pose, a hand to foot pose, equestrian pose, a mountain pose, a salute with 8 parts pose, a cobra pose, the mountain pose. And then you can see through this pathway of 12, with chanting of various mantras, it is a process, and it is a part of balancing the imbalance between parasympathetic and sympathetic nervous system. So we know that there is an imbalance between rest and digestion, flight and fright. We know that the parasympathetic activity dominates when we take rest and when we are doing digestion. We know the sympathetic activity dominates when we are frightened or when we are, fighting. And we need that right autonomic balance. And some of these asanas like Surya Namaskar can restore that balance between sympathetic and parasympathetic nervous system, which is manifested in lay people literature as stress. And these are de-stress mechanisms which not only will help you from a psychological standpoint, but will also help you from a medicinal standpoint, muscle mass standpoint, correcting that sarcopenia standpoint, and correcting cardiometabolic diseases in general. So clearly we need to generate evidence, because when we talk of ancient wisdom and when we talk of ancient science, they were not born in the era of evidence-based medicine. So we as scientists need to recognize these are some of the papers which my collaborators from Calcutta, Dr. Shambho Samajdar, Professor Tripathi Shantanu, we have done work. For example, we reduced anxiety of young athletes and improved their attention, memory, and mental state by Gayatri Mantra chanting. Or by Om chanting, we were able to improve quality of life with COPD patients. Or in COVID times, particularly in the elderly, by doing yoga prescriptions, we were able to improve lung compliance. So you need to generate science. You need to do randomized control studies to prove what is already known in the ancient literature and try to put an evidence base to it and a high level of hierarchy of evidence. Finally, as I conclude, we need to understand a couple of things in medicine. That we are all here to stay and live long. And our mantra should be to eat slowly. Don't eat fast. Because we know when we eat fast, we contract our beta cells. Eat less. Don't eat too much. Because caloric restriction makes us live longer. Eat on time. And don't skip meals. And eat the right food. Eat sattvic food. Don't eat tamasic or rajasic food. Do a lot of physical exercise. Do your 10,000 steps. Do yoga, do pranayam, do Surya Namaskar. Do chant the Gayatri Mantra. Sleep well and sleep on time. And try to be smiling, because it's very, very important that we are in best of times, as Charles Dickens said, but we are in worst of times. And try to do 1 hour of digital detox every day. And try to ensure that we are committed to health and happiness for all the people around us in the community, for all the people with disease states in our community and people around us. So it's very, very important to rationalize and put an evidence-based construct in mind-body medicine and try to have a happier life, a mentally stable life, a digitally detoxed life, so that we can have a better future. I really appreciate the opportunity given to me by the entire team, particularly Dr. Vaishali Deshmukh and our entire team. And I'm grateful to all of them, so that we could at least try to adapt some of what I have said in our modern day practices. We should practice what we preach so that we can help people living with diseases and even with pre-diseases and even community at large, so that they can have a healthy life, a happier life, and they can live long without any comorbidities or complications or multimorbidities. Thank you so much for a patient hearing.
Thank you, sir. And that was, I think, what I was referring to. It's difficult to gauge the depth. I think the depth of your knowledge is also so vast and so intense. So would you like to give your special comments, or would you, anybody from the audience? We have Dr. Shekhar also with us, and we have certain eminent personalities with us. So anybody else who would like to share their views? Dr. Joshi, sir, you?
I think, Vaishali, I'm grateful to you that you're doing this meeting and putting lifestyle, mind, body on focus. As I said, that we need to generate evidence base from our ancient wisdom to modern medicine. It's a journey and a path. We are all like-minded. Let us all come together and generate some high quality, impactful science and reboot what is already known in a more structured and a scientific way. And I'm certain that our own ancient practices had a lot of science and a lot of wisdom. and let us ensure that it is put in the current perspective so that the world benefits. We are the leaders of G20 today. We believe in the concept of Vasudevam Kutumbam. So, you know, we really are one earth, one family. So I think it's not just, and we are the largest country probably in the world in terms of population now, because, you know, there are 8 billion people on planet Earth. There are 1.4 billion people in China and equal number in India now. So more than 1/7 of the world population lives in our country, and our rich heritage has to be translated into rich science. We have seen that we are now leaders in space science. I'm certain that if we are able to get our lifestyle practices invigorated in the modern medicine science, I think the preventive health and promotive health will benefit a lot. And I'm really thankful to you, Vaishali, for leading this initiative persistently and consistently. So I think my congratulations to you and your entire team for persisting with this and continuing this, because normally most people start and then they peter off. And thank you so much.
Thank you, sir, for your precious presence, and thank you for your guidance. And I am sure that the future will be guided by what you will be mentoring us. So we definitely need your support to carry this forward. And we agree with you that it needs to be an integration of the traditional medicine with the modern medicine, and so that it can be more applicable to our population. So, Dr. Shekhar, you had something to comment upon? Yeah. Hello.
Dr. Shashank, hi. He is a great friend of mine, and every time I meet him, I tell people, when Dr. Shashank speaks, you listen. When he stops speaking, you start practicing what he spoke. Thanks.
Thank you, sir. I think I agree with you. I can't deny the fact. So thank you so much. And thank you, Joshi, sir, for being here.